Hi, this is Dr. Toby Moma, your host on Health and Wellness with Dr. Toby, inviting you to watch our show this week. Our guest is Shaterika Sampson. She's a professional licensed counselor at the Methodist Children's Home in Ruston. She's a member of the Assembly West Monroe. She's a Christian and she's a counselor. It's not every day you find a Christian counselor. And she's working with some of the most disadvantaged kids in our community: sex trafficking, bullying, children who have been abandoned, molested, and abused. She's talking about how she uses her psychological background. She has a psychology degree from the University of Louisiana Monroe, and she has a master's degree from Louisiana Technique. She's also pursuing her PhD right now with Walden University, and she's going to be sharing how she puts her Christian faith together with her psychology background to make a difference in this girl's and boys' lives. She's going to be sharing about her relationship. She's gotten married and how God kept her through that impurity. You don't want to miss it. Look forward to hearing from you. God bless you. Jesus is Lord. Hi, this is Dr. Toby, your host on Health and Wellness. It's a pleasure to have you on the show today. Don't touch that dial. We have a great show with Shaterika Sampson. She's a licensed professional counselor currently working at the Methodist Ruston Home for Children, and it's an experience to have her on the show to tell us what she does and how she can be a blessing to us in the body of Christ. It's not every day that you have a Christian counselor. So you're faced on the social media, on the television networks, with all kinds of psychologists and counselors from a circular, pantheistic, post-Christian worldview. But it's a pleasure, it's a delight, it's a Christian blessing to have a Christian counselor who can share things with the Bible as her background. So you're welcome on the show, Shaterika.
Thank you.
Real pleasure having you on the show. So tell us about the Ruston Children's Home. You said it's been there since 1902.
Yes, actually, they initially opened in 1902, actually as an orphanage in Bunkie, Louisiana.
Okay.
And from there, several years later, went ahead and expanded, and now we have the building that you are familiar with now in Ruston. We also have two other facilities around the state, as well as a community counseling center, an outdoor wilderness learning center where we provide horse therapy or equine therapy. And we're just continuing to grow. We're looking at maybe opening some other facilities in the near future to better
So
accommodate
are
the
you
children of the
guys
state.
the one was it the one in New Orleans? Was it started from here?
Yes, sir. The one
Really?
here in Ruston is actually, I guess I would call the headquarters.
Really?
Yes, sir.
You would think New Orleans was first. Oh
Right.
wow, wow, interesting. Obviously they had, was it a Methodist initiative?
It was.
The Methodist Church kind of laid
Yes.
the platform for that.
Yes, sir.
Okay. And those were in the days, obviously, in the days past. So tell us what you do in that facility. What's your role in that facility?
Yes, my role is a licensed professional counselor. We call them therapists. So I have a caseload of about 6 children, and those 6 children receive individual therapy twice a week for an hour at a time. I also provide group therapy services to our young people, and they get 2 group therapy sessions for 30 minutes each week. And when necessary, I also provide family therapy for my children, but we also have family therapists on campus who do nothing but family therapy.
So the people watching are asking, why don't they get that in school? Don't they have guidance counselors? Don't they have people who can do that? Why are those kids out of school in a facility? What have they done to make them so different from the rest of their colleagues?
Well, luckily, I will say at the Louisiana Methodist Children's Home, we actually have school on campus. Howard School, which is a Lincoln Parish state-approved school, is housed on our campus, as well as the John Allen Vocational Center is located on our campus. So even if the children are in a residential setting like ours, they are still continuing their educational journey. But as regards guidance counselors and things in our public schools, um, mental health in the school setting seems to be where a lot of our budgets in Louisiana are cut very frequently. So a lot of times our guidance counselors are more so having to deal with testing preparations for state testing and a lot of paperwork more than they're able to provide one-on-one therapy for the children that attend that school.
Mm. Who are the regular clients you see at the Ruston Methodist Home? Because some of my video viewers are wondering, well, who goes there? What do I need? What's the criteria? Are there specific criteria?
Yes, there is. With us being a psychiatric residential treatment facility, the children that are admitted to our facility need to show any level of extreme disorders or dysregulations or inability to cope within a home or community setting. As people can see on our website, and I can give that website a little later, a PRTF is probably considered one of our highest levels of residential care. If at all possible, we would love for children to be able to go to a group home for a shorter span of time, something a little less restricted. But for those children who cannot control their aggression, who cannot get along within the family settings, who have been victimized, whether that's physically or sexually, or been neglected, just children that do not possess the skills necessary to be successful in the community setting, they are ideal for our program at the children's home.
And how do you get paid? Obviously, my viewers are like, I don't have the money for that.
Absolutely. We do accept Medicaid and we also do accept private insurance. So upon completion of an application to attend the Methodist Children's Home, a request will be made to that child or that family's insurance company, letting the insurance company know we have this child here, here are the presenting symptoms. Will you approve coverage for their stay here?
Mm. And it's not for profit, right?
No, we're a nonprofit
You're not
agency.
for profit. What if somebody's watching and saying, I don't want my child to become converted to Methodism? I mean, the name says Methodist Children's Home. So
Right.
give us an idea of a snippet into how the gospel is involved. Is there a chance of what they call proselytization? So somebody's watching and like, oh, I don't want my child to become a Methodist. We were born a Baptist. I don't want my
Right.
child to become, you know. So is that a problem in the facility?
It can be, but I think we have some of the proper safeguards in place to kind of prevent that from happening. We do offer chapel on campus that is more so modeled after the Methodist faith, but our children are not required to attend. They definitely have the opportunity and the choice to say, yes, I will attend. No, I do not want to attend. And we've even had clients before who would request to be baptized in the Methodist church. And before we would ever baptize that child, we have to get consent from their legal guardian to speak to them first. And even on Sundays, because chapel is actually offered on Wednesdays, on Sundays we take our children to different denomination churches as long as they still have the same foundational beliefs of Jesus Christ, the Trinity, and things like that. And again, the child's choice.
Okay. Give us an idea what the child's ages range from, because are we talking of 2-year-olds here? Are we talking of
No.
5-year-olds? Are we talking of
We're looking at starting at about 8 years old up to
okay.
17.
And these are not kids that are leaving, is it Green Oaks? Am I correct?
The detention center.
Yeah, these are not kids who have, because there are people watching that like, I don't want my kids to hang out with, delinquent, drug using.
Yes.
So give us an idea of the average child in the Methodist Ruston Children's Home. Are they, I'm just trying to be frank here, are they
Yes.
ex-drug users? Are they ex-pimps? Are they people who have committed murder? Or are they just people with emotional mental health disorder that need a psychiatrist in-house to monitor them on a closer basis?
We do have a relatively wide spectrum of clients that we do get. However, we do have different houses on our campus. So we have a residential housing where we have 2 girl houses and 2 boy houses.
Also, it's both male and female.
Yes, sir,
Okay.
both male and female. And in those residential houses, those would be our less extreme cases. Those are the children that are typically not going to act out aggressively. These are our children that probably have more emotional needs more than anything. And then we also have what we call the Scott building. And in that building is where we see our higher level profile kids. Those are our aggressive children. Those are our children that run away very frequently. Children that may have been exposed to sex trafficking before. Some of the higher profile things that you were referring to. So both of those things will be on the campus. However, we try to separate them based off what is the presenting concerns that have the children here. So we do try to keep them separated as much as possible, but we will see a little bit of everything.
And they still take like the ACT. I mean, is that a normal school system?
Normal school system, yes, sir.
So what happens at 17? I mean, how long can they stay there? I'm sure there's a time frame.
Yes, we
Okay.
typically do not allow clients to stay past age 18. However, we do have a provision called an 18-year-old agreement where we meet with the child that maybe is not afforded another place to go, or we're still trying to get transitions services set up for that child. And usually our CEO, given the situation, will sign off on allowing that child to stay. They'll typically have an individual room separate from the much younger children. But typically at 17 going on to 18 is when it is at that time for that child to
But how
discharge.
many months or years can somebody stay at the Methodist Children's
It
Home?
typically varies. On average, we're not going to see a kid stay there more than 6 to 8 months.
Hmm.
But depending on the cases, we do have some outliers that kind of lay out of there as well.
Okay. And you said the psychiatrists come into the Methodist Children's Home,
Yes, sir.
so they don't go out to Conway, Shreveport. They don't, but they have pediatricians in the community
Yes,
if they
yes,
need
sir.
to see a general pediatrician.
Yes, sir. We actually have a nurse practitioner on campus at all times, so we do have a nursing station for things that can be handled, pretty relatively easy. But if they need a pediatrician or a specialist or any other form of a doctor, our nursing department sets those appointments up and actually transports our children to those appointments.
Wow. How you guys fund it? I mean, apart from billing, Medicaid, I'm sure Medicaid is probably your biggest.
Yes, one of the
Yeah.
biggest.
So how do you have church funds? Do you have people donating to you? Do you
Yes.
have foundations?
We have church funds and donations that we do receive. And our outdoor wilderness learning center that I mentioned a little earlier, they have some custom jellies and custom salsas that they actually sell and use those funds as income for the children's home as well.
Wow. What do you think the benefit of the Ruston Children's Home to the state of Louisiana has been? If you look at it from a, if that facility was not here, what would the state have not benefited from?
The state wouldn't have benefited from a place to rehabilitate some of the most hurt and most forgotten children that we have in this state. We've had children before that have been left in very bad situations because there was simply nowhere else for them to go.
Even foster homes wouldn't take
Even
them.
foster homes, specifically even for teenagers, there is such a scarcity of foster homes that will accept teenagers. Even currently, with a case I'm working now, there are not any openings. It's not even that no one wants this child. There's no openings. And even with our children, some of their histories with the acting out behaviors or any aggression they may have shown kind of pushes some of those foster families away out of fear or concern. So Louisiana really wouldn't have anything to really offer or
Mm.
give our children if the Louisiana Methodist Children's Home hadn't stepped in.
Tell me, well, there's a lot of talk about the drug epidemic, opioid abuse. So I want you to be able to differentiate for me between Methodist Children's Home and a drug rehab. Because
Okay.
you hear people say, I'm going to send my 16-year-old kid to a drug rehab.
Hmm.
That's not what you guys do.
No.
So what do you do for a child who's dependent on drugs and he can't do without narcotics and meth, and
Yes,
is that
absolutely.
somebody you guys identify and treat, or
Yes, depending on the severity of it, there are some instances where there are children that have an extensive drug history and they're unable to even begin to process their traumatic experience or their emotional dysregularities. So they possibly do need a rehab type facility prior to even coming into our setting. So that's more on an individual basis, but the children that we do have on campus that have a history of substance abuse, who are maybe still having those cravings or still anytime they get emotionally aroused or needing to go smoke or go drink, we do have a substance abuse counselor on campus who provides not only individual therapy sessions for those children, but also a group therapy setting, kind of mimicking the AA or the NA setup to kind of build a community within the Methodist Children's Home.
so what do you do for kids, I mean, who smoke cigarettes, and I mean, what do you do? I mean, are there rules on that on the campus?
Yes, they are not permitted to have any of that. Even if they're 18 and they happen to still be on campus for that 18-year-old agreement, one of the agreements is that they will not use cigarettes, alcohol, any other illegal substances, vaping, anything like that. None of that is permitted on campus, not for the youth nor for the staff and the other
And if you're
workers.
caught,
And if you're caught, either termination or for a child, we try to be a little more gracious, a little more lenient. So we're going to search and make sure that there are no other cigarettes or anything like that that they have access to, and probably have them on a high supervision alert to make sure that they do not gain access any other way.
I mean, you keep referencing sex trafficking, and I know that the sex trafficking industry is, I think I heard the other day, it's a $70 billion industry.
Yes, sir.
It's considered the number one or number two dark industry in the world today.
Yes, sir.
So it's huge, but people don't know about it. In fact, we hear stories that the I-20 corridor
Oh,
is
yes.
a big traffic for the sex traffic trade. So how many of your kids have you had that, I mean, are there, I mean, you guys have like 200 kids, maybe?
We actually house 96.
96
Yes,
kids,
sir.
okay. I mean, are there more than one or two, or is it
Oh, absolutely. If I had to just give a percentage, I would say maybe about 20% of our children that we get have been sex trafficked.
like traffic, not abuse?
Not abused, trafficked.
They were being in some motels, and
Yes, sir.
so how did you guys catch up with them? I mean, the police caught them and then brought them to you guys.
Yes, sir. That's typically how it works. We've had clients that even have been over state lines with trafficking. And just to even speak to that, it appears that a lot of the trafficking starts through social media. Typically, you have a perpetrator who is, or a pimp who is impersonating a 15 or 16-year-old boy or girl. They start building trust through this dialogue. They may even go as far as getting some man or some woman who looks young to maybe FaceTime with this child to continue to build up and foster that belief that this is truly who they say they are, get them to a point to where they're willing to meet up with them. The child sneaks out of their home or tells their mom they're going to see a 14 or 15-year-old friend, and they get there and maybe there's two adult men that just pick them up and take them. I mean, social media is typically the way that a lot of our children have gotten into
So
trafficking.
this is really happening.
Yes, sir.
Wow. And these kids, I mean, they share horrible experiences of being sexually used multiple times a day.
Yes.
That's unbelievable. And we're talking about 15, 16-year-olds here.
Yes. And I've seen a trafficked youth as young as 14 who started in that lifestyle when she was about 12.
Obviously, they don't have they don't have an education in that situation.
No.
They can't go to high school. They
No,
can't,
sir.
and they have a lot of inhibition. Their emotions are inhibited, and that's just tragic. Oh
Yes,
my
sir.
goodness. I mean, I know we have a lot, but I didn't know it was that many.
Yes,
You
yes,
know.
sir.
So what do you do for a child who does not have insurance? I mean, I'm just curious because some people are watching are like, well, what if they don't have insurance? What can they do?
Same.
Does the Methodist Home offer facilities on a pay-as-you-go basis or as,
Not
gratis?
that I'm 100% sure of. I'm sure that that's something that would be considered or even entertained through just a simple conversation. Because working at the Methodist Children's Home, I've learned in comparison to some other things that I've seen that they are very invested in making sure children get what they need, even if that means that the children's home needs to fit the bill. So I think just a simple conversation could definitely open up some options and opportunities for that family.
And the Methodist Children's Home feeds the children.
Yes.
They feed them. I don't know what they do with the washing of their clothes.
Yes, each residence has one, if not two, depending on the size of that particular building, washing machine, dryer machine, and they have access to it free of charge.
Okay. So you have food, you have clothes washed, so you have accommodation, you have medical care. I mean, and those parents are not paying anything?
Typically, it's just insurance.
Wow,
Yes, sir.
that's amazing.
Yes, sir.
'Cause that's thousands of dollars just there already.
Absolutely.
Yeah. So right now, like you said, we have this scourge of drug and narcotic dependence, and it's become a a big deal in our community, especially in the South. So so you guys have like substance abuse counselors
Yes.
that people can reach out to.
Yes, sir.
Wow. I'm just curious if you have somebody who's I mean things like marijuana, heroin, cocaine. What they typically do is they see the counselor regularly.
Yes.
Okay.
Yes, sir.
Because in our field of medicine, we use other things like Suboxone and Naltrexone
Right.
to help them get off those. So I
Right.
don't know if the world of pediatric psychiatry is a little different.
Yes.
Yeah. So have you seen any of that introduced in your patients who have long-term
Currently.
dependence?
Currently, I have not.
Okay.
No, sir. But I'm sure that that should be an option. I don't see
Right.
why it wouldn't, necessarily be an option.
So in your field where you see those kids, do you see a lot of Prozac, Adderall?
Yes.
So basically, those are meds that we use for antidepressant, ADHD. So is ADHD a big deal, or is it just a myth? I mean, what's your
It's
opinion on?
I think there's a mixture. I do believe that there are some children that truly do have ADHD.
Which is
Um,
attention deficit hyperactivity disorder. And
yes.
what we're saying is that a lot of unfortunately, some parents just push that on the child.
Yes.
So the child now gets this stigma that you're overactive, you need this medicine, and they begin to run with it. So I don't know how many you're seeing in your setting for the ADHD.
Probably very close to almost 100%.
Really.
I think a lot of that has to do with a number of factors. One of the factors being for therapy services, whether they are residential or outpatient in type. A lot of parents are unable to pay for those services, so they have to rely on insurance to pay for them. And insurance has this list of diagnoses that they are willing to pay for services for, and ADHD tends to be one of those as well. Sometimes I do think it may be a cultural difference, especially if you have, for instance, an African American boy in a white female's classroom. Maybe the way this child behaves in her class is not a norm, personally for her. And it kind of raises a red flag, and so she may suggest, does this child have ADHD? Does this child have that? When that may be a cultural norm for us as well. And then the last factor I think may contribute to that is the need of maybe like SSI benefits or things like that. We have seen or I've personally seen when I worked part-time in a school setting, that you'll have parents that need documents completed stating that this child is a disruption in class, this child is ADHD, this child has that, in order for them to obtain some of the government assistance that they may need to run their household.
And you think that's wrong, right?
I do.
Yeah. And I tell people all the time, I think it's not right. I mean, you're
Yes.
stigmatizing this child's health status because you want to get some benefits.
Yes.
And what we do as doctors, I don't know if you're familiar with this, but you cannot make a diagnosis of ADHD without doing 3 settings testing. That means
Okay.
school testing, home testing, and then clinic testing.
Okay.
So we need to see you in those 3 settings, and there has to be a consensus
Okay.
from all 3 settings that you have ADHD. And for us to diagnose you, in my university at Mississippi, there's a battery of tests that we run.
Wow.
And after we do the battery of tests, the psychologist sends to the physician and says, this person, after running this test, looks like he does have some concerns. Then we start the medicine.
Okay.
But what was happening in the past was a lot of people were getting started on ADHD meds without the requisite testing being done.
Right.
And what we don't realize is that it's a stimulant. And unfortunately, some people like to feel high,
Yes.
and it becomes a source of dependence and abuse for other drugs in the future.
Very
You
true.
know, it's a sympathomimetic, it makes you feel high and all that. So it's important that we know those rules so that we can follow through with that. So tell me a bit about other rules in the Methodist Children's Home. So no smoking, no vaping,
None of
no
that.
drinking,
Yes, sir.
sex, relationships between sexes.
No, they're not permitted to have that.
How
But
do you
even,
restrict that? I mean, you're not
right,
there
and
24 hours, are you?
I'm not. Now there are other staff that are there, but we understand that with that age group, especially with our preteens and our teenagers, that is a normal developmental area of their life. They're going to like people and things like that. So we do have on campus socials that are supervised by different staff and different officials on campus to allow them to have those age appropriate interactions. But outside of that, if they're not supervised, they are not able to mix sexes. They are not able to be, even if they are the same sex, in any setting together alone, there's always some adult that is present. But also on campus, they're not able to have access or use or possession of a cell phone or any other Wi-Fi type technology, whether that be a laptop, iPad, or anything like that.
So you're trying to tell me there's been no history of abuse or molestation on the Ruston Children's Home?
Not to my understanding.
Okay.
Now, I've only been there 3 years,
No,
Dr.
that's
Toby.
no, that's positive because what
Yes.
you hear from a lot of group homes is if it's not male to female, it could be inter-female or
Right.
inter-male.
That's true.
So that's I'm just saying because when my viewers are concerned, if I send my son, I don't want some other boy to
Right.
molest him,
Right. One thing I
So
do appreciate at the Methodist Children's Home, not all of our children are allotted to have private rooms. Sometimes I think that's just a space issue. But if a child has a roommate, if the two children are in the room at any time, there's a staff that has to sit in their door. So there's someone with eyes and ears at all times.
really,
Yes, sir.
wow, that's a lot of staff.
Yes, sir.
So that's another particular aspect of a Methodist home that I think is awesome. You guys are doing a terrific job.
Thank you.
Um, when we come back on the next show, we're going to talk about Shaterika and how she's developed into such a godly, God-fearing woman, and how God has taken her from where she is to where she's going. She's going to talk to us about her future and what she sees in the future for herself, her parental heritage, and what she's built upon over the last 27 years of her life.
Yes, sir.
So we don't want you to miss next week because we're going to be sharing some things that have made this woman the woman that she is. She's inspiring our teenagers to be a better them. Okay, those kids, many people don't want to work in those settings. They want to work in a 9 to 5 job where they have settees and cushions and wall-to-wall padding and air conditioned. And she could have worked in those settings, but she chose to work at the Ruston Children's Home with some of the poorest and maybe most neglected children in our community. So she's going to share with us her heart. And I just want to show you my new book. It's called The Spirit of Acceleration. It's a new book I did. It's on how you can accelerate your destiny. Look it up at faithandpower.online and it'll bless you. So we're going to be here next week sharing with Shaterika Sampson. And we're going to be also in the Monroe area March 27th sharing on a theme called Double Doors at our Match Holy Ghost Night, 11 p.m. to 4 a.m. This is our year of liberty. If you want to walk through double doors, you need to know how to do it. You don't want to miss it. Look forward to seeing you March 27th, 11 p.m. at the Clarion Inn, now Oyo Hotel on 165. Don't forget, Jesus is Lord. God bless you in Jesus' name.